Hello learners, today we are going to talk about psychological testing and forensic exams. My name is Dr. Leah Kaler and I'll be walking you through this today. So the very first thing that we need to talk about is testing is not the same thing as assessment. In forensic psychology, the terms test and assessment are distinct, with specific implications for evaluating individuals within legal contexts, and we are going to talk at length today about how they differ. So let's start with the scope and purpose. In forensic psychology, a test is a standardized instrument used to measure specific psychological traits, abilities, or symptoms. The purpose of a test is to gather objective data about an individual's mental state, their cognitive abilities, personality traits, and other psychological characteristics. The results are often used to answer specific legal questions, such as determining competency, diagnosing mental illness, or assessing risk. And some examples of tests would be the MMPI for personality assessment, or the Wechsler Adult Intelligence Scale, the WAIS for cognitive ability. We are going to talk in depth about both of these in future slides in this particular lecture. So swapping over to assessment. The definition of assessment in forensic psychology is a broader process that includes the use of tests along with other methods such as interviews, behavioral observations, case history reviews, and collateral information to evaluate an individual. So the purpose of an assessment is that goal is to provide a comprehensive evaluation that answers complex legal questions such as determining criminal responsibility, risk for reoffending, competency to stand trial, and the very important piece here is that it integrates multiple sources of information to form a really well-rounded opinion. An example of a forensic assessment would be evaluating for determining for competency to stand trial, which may include cognitive tests, interviews, reviews of medical records. So now we're going to swap over and talk about the nature and content. First, let's talk about tests. They are typically structured and have standardized procedures for administration and scoring. They are designed to provide quantifiable data on specific psychological constructs. And tests measure specific aspects of psychological functioning, such as intelligence, memory, or psychopathology. Swapping over to assessment. Assessments involve multiple methods and sources of information. They are not limited to just test scores. They also include qualitative data. So assessments consider a wide range of factors, including an individual's history, their behavior, their context, to really form a complete picture of their psychological state in relation to legal issues. So you can think about assessments as a very holistic evaluation. Next, let's talk about both of these in the application of forensic context. Tests are often used to gather objective data, as we discussed earlier, and can support or refute hypotheses about an individual's psychological state. For example, a test might be used to measure cognitive impairment in a case involving a claim of diminished capacity. Tests can really provide a snapshot of the individual's psychological functioning at a specific point in time, often within a controlled environment. Assessments are often used to inform legal decision-making. For instance, a forensic assessment might be conducted to determine whether a defendant is competent to stand trial or to evaluate the risk for future violence. Assessments take into account the legal context and the broader implications of findings. They involve synthesizing information from tests and other sources such as interviews, records, and behavioral observation. So let's just wrap that up. In forensic psychology, a test is a specific standardized tool used to measure particular psychological attributes. On the other hand, an assessment is a comprehensive process that integrates test results and other information to address complex legal questions. The assessment provides a more complete and legally relevant evaluation, often crucial to informing legal decisions. So as we start to talk about this more and more in our time together, we are going to define these two terms. And as you can see, that testing can be and often is part of a psychological assessment, but it is not equivalent to an assessment. Psychologists are trained to gather, organize, and interpret data from various different sources together to make a meaningful whole. This can be a very daunting task, especially if we're getting conflicting information from various sources, which we often will. While tests can be very informative, a forensic psychologist oftentimes needs other data. It's going to be very important for us, such as clinical histories, behavioral observations, collateral interviews, and we're briefly going to discuss each of these. So a clinical history in forensic psychology refers to a comprehensive collection and evaluation of an individual's past psychological, medical, and social background. This history is crucial for understanding a person's mental health, behavior, and how these factors may relate to legal issues. So some key components of a clinical history. First and foremost is going to be mental health. This is going to be gathering information on past and current psychiatric diagnoses, treatment, hospitalizations, therapy, and medication use. Medical history is going to be very important for us as well. We are going to be gathering details of physical health issues, neurological conditions, injuries, particularly those that may affect cognitive or emotional functioning, specifically head injuries. Next, we want to inquire about substance use history. We need to ask about alcohol, drug use, any related treatments or rehabilitation efforts. We're also going to gather background information on family dynamics, upbringing, relationships, education, employment, and social interactions. We would be remiss if we didn't ask about criminal history. We need to gather information on past criminal behavior, arrests, convictions, and any previous forensic evaluations or court-ordered treatment. And lastly is going to be behavioral observations. We are going to talk at length about behavioral observations in our next lecture, so stay tuned for that. But in a nutshell here, behavioral observations are going to be notes on the individual's demeanor, communication, behavior during the assessment process. The purpose of providing the clinical history really helps forensic psychologists contextualize the individual's current state, their mental state, their behavior within a broader framework of their life experiences. And this information is critical for forming opinions about legal matters. So let's talk briefly about collateral interviews. These are crucial in forensic psychology because they provide additional perspectives and information that the individual being assessed may not offer or may not be aware of. These interviews often involve speaking with people who know the individual well, perhaps that's family members, friends, co-workers, or other professionals involved in their life, such as doctors or therapists. So we need to verify information. It's going to be very important that these collateral sources either verify or refute information provided by our individual that we're assessing, ensuring that the forensic psychologist has a more accurate and complete understanding of this person, their history, and their behaviors. Collateral sources can also provide insights into the individual's behavior, mental state, and interactions that person that we are assessing may or may not disclose, or perhaps they downplay. So this is going to be particularly important in legal context where information and accurate information is going to be of the utmost importance. So these collateral interviews may help us uncover additional details. These collateral interviews may also help the psychologist understand the broader context of the individual's actions, such as some environmental factors that were going on at the time, relationships, stressors, which is essential for making an informed legal recommendation. We also want to assess the person's credibility. These interviews are going to help us determine the credibility and reliability of the person that we are working with and their self-reported information, which is obviously going to be vital for us in forensic evaluations when the stakes are very high. So collateral interviews are going to enrich the forensic assessment by providing a more comprehensive and objective view of the individual that we are working with, which is going to be crucial for accurate legal evaluations and decision making. So we have to ask ourselves some questions, and the first question that we're going to ask ourselves is, do you need to use a test? There are going to be several questions that I encourage you to ask yourself when choosing tests for your batteries. Is this test commercially available? The more widely used, the better. We want to use tests that are established in the field, that are well known, that are also used by other forensic psychologists. We want to know, has this test been reviewed? Is it from a reliable source? We want to know if we are going to consistently get good information from this test, and can it be trusted? We want our reliability for the test to be at least 0.80 for us to consider it to be reliable. We also want to know if the test is going to be relevant to the legal issue or the psychological issue that's underlying this legal issue. Again, we're going to talk much more about this as we move through the semester, but this is just a little taste as we do our introduction here today. Psychological tests are very standardized, as we discussed earlier, in the way that they are supposed to be administered. They have administration protocols to ensure consistency, reliability, and validity throughout the assessment process. Standardized protocols ensure that every test is administered the same way, regardless of who is giving the test or where the test is being administered. This uniformity allows for comparison of results across different individuals and different groups. Standardized administered tests also reduce variability caused by differences in test administration, which helps to ensure that the test results are going to be reliable. We discussed this on the earlier slide. That's going to be very important for us. If the test is repeated under the same conditions, we should continue to get the same results. With regard to accuracy, we need to measure accuracy of what the test is intended to assess. So maybe that is intelligence, maybe it's personality traits. The conditions under which the test is administered must be consistent. So standardized protocols help to maintain the validity of the test by minimizing external factors that could potentially influence the results. Standardized administration ensures that all test takers have the equal opportunity to perform based on their true abilities rather than being influenced by variations in testing conditions. This is particularly important when we are looking at settings of educational assessment or forensic evaluations where fairness is going to be critical. Many psychological tests are norm referenced, meaning that the individual that we're working with, their score is compared to a normative sample. So standardized administration is crucial because it ensures that the scores are comparable to norms, providing meaningful interpretations. So when we adhere to standardized protocols, it is often a requirement in forensic settings where legal and ethical guidelines demand that assessments be conducted in a manner that ensures fairness, accuracy, and professionalism. You must ask yourself how much time you have with the individual who is being assessed and the testing situation, as well as time constraints. These are all very real barriers in forensic assessments. In your mind, you may have the perfect battery that you'd like to give, but maybe you only have limited time with that person, or perhaps the environment where the testing is going to take place is very loud and distracting, and we need to take this into consideration. I have done many forensic assessments where we only have a very small room in a very loud environment with limited time constraints, and that makes forensic testing very difficult. So start to prepare yourself for these conditions. Again, we're going to talk about this more in depth when we talk specifically about the ways. We must ask ourselves, can we adequately follow the proper administration protocols? As we talked a moment ago, tests will be based on a normative sample. Is the test you're using validated for the person you're going to test? Are there appropriate norms? A very important aspect of tests for the legal context is assessing for response style. For example, malingering, which we are going to have an entire lecture on, and this is going to be vital in our role as forensic psychologists. So let's talk a moment about actuarial data. It's crucial for forensic psychologists because it enhances the accuracy and objectiveness of their assessments, particularly in high-stakes legal contexts. So actuarial data involves using statistical methods to analyze patterns, predict behavioral outcomes based on large data sets. This approach often leads to a more accurate prediction of future behavior. For example, the likelihood of reoffending or violence compared to clinical judgment alone. Actuarial data helps minimize personal biases that might influence a forensic psychologist's judgment. By relying on statistical models and established risk factors, the assessment is much more objective and less influenced by subjective interpretation. Actuarial tools provide standardized methods for assessing risks, ensuring that similar cases are evaluated using the same criteria. This consistency is essential in legal settings where fairness and equality in assessments are going to be absolutely critical. Actuarial data can strengthen a forensic psychologist's testimony by providing scientifically grounded evidence that's more likely to be accepted in the courts. The use of actuarial tools is often seen as more defensible in legal contexts because it's based on empirical research. Actuarial tools are commonly used in forensic psychology to assess the risk of recidivism, violence, or other behaviors relevant to legal decisions, and these tools can help classify individuals into risk categories, aiding in decisions about sentencing, parole, or treatment. And then lastly, by accurately identifying individuals who are at higher risk, actuarial data helps in the prioritization of interventions and resources. This is particularly important in criminal justice and mental health systems where resources are often limited. So as we think about the tests we want to use, those that have objective and actuarial data are preferred when appropriate outcome data and algorithms exist, depending upon what our referral question is. So let's talk about a few commonly used tests, such as self-report measures, as well as personality inventories. Self-report measures may be used in your battery of tests, oftentimes it will be. A self-report measure in forensic psychology is a type of psychological assessment tool where individuals provide information about their own thoughts, feelings, behaviors, and experiences, typically through questionnaires or structured interviews. And these measures rely on the individual's subjective reporting and are commonly used to assess a variety of psychological constructs, such as personality traits, symptoms of mental disorders, and attitudes. So let's talk about a couple of key features in self-report measures. So with regard to structure, these are typically composed of a series of statements or questions that the respondent must answer. Often they use a Likert scale. So for example, it may be several options from strongly agree to strongly disagree, or it could be a true-false format. In some cases, self-report measures may be administered through a structured interview where the individual verbally responds to standardized questions. This may be very common when you're working with individuals in the forensic context, as their reading ability may not meet the level that is needed to be able to do the self-report questionnaire on their own. So some common uses of self-report measures in forensic psychology. These tools can help identify symptoms of mental health conditions, such as depression, anxiety, or PTSD. All of these are going to be very pertinent in legal context. The self-report measures can assess tendencies towards specific behaviors, such as aggression, impulsivity, substance use, and these may influence risk assessments or criminal responsibility evaluations. Some report measures assess attitudes or beliefs that may be relevant in forensic settings, such as attitudes towards violence or authority. Some advantages of self-report measures are that they are typically quick and easy to administer, making them a practical choice in many forensic settings. And these measures provide direct insight into how the individual perceives themselves, their experiences, which are going to be very valuable for understanding their psychological state. In forensic contexts, the accuracy of self-report measures can be compromised by intentional deception, such as malingering, which means exaggerating or faking symptoms, or perhaps underreporting symptoms. And for this reason, many self-report measures include validity scales to detect inconsistent or dishonest responses. Since the data is self-reported, it reflects the individual's subjective perspective, which may not always align with objective reality. This subjectivity must be considered when interpreting our results as a whole. The legal context can influence how individuals respond to self-report measures. For example, a person might alter their responses if they believe it will benefit their legal case. So let's switch over and talk about personality inventories. These are widely used in forensic psychology to assess an individual's personality traits, their psychological functioning, in various legal contexts. These assessments help forensic psychologists make informed decisions about an individual's behavior, their mental health, and potential risks in relationship to the legal question at hand. So let's talk about a few key uses of personality inventories within forensic psychology. Personality inventories such as the MMPI, which we will talk about in much greater detail, or the PAI, which is the Personality Assessment Inventory, are used to identify the presence of personality disorders, which may be relevant in cases involving criminal responsibility, competency, or sentencing. These tools help assess characteristics like impulsivity, aggression, and emotional stability, which can influence legal decisions, such as evaluating the risk of reoffending or determining suitability for rehabilitation programs. Personality inventories can also be used to assess whether an individual has the psychological stability and cognitive functioning necessary to understand the legal proceedings, to participate in their own defense. This is going to be very important for competency to stand trial. And on the other hand, in cases involving guardianship or the capacity to make legal decisions, personality inventories can provide insight into an individual's mental health and decision-making abilities. When it comes to risk assessment, personality inventories can help evaluate risk of future violent behavior by identifying traits associated with aggression, lack of empathy, or poor impulse control. This information is going to be critical in parole decisions or sentencing or assessing the potential danger to the community. In cases involving sexual offenses, personality inventories can assess traits and behaviors that might indicate a higher risk of reoffending, which can influence decisions about treatment, monitoring, or confinement. We can also use personality inventories to assess the mental state of an individual at the time of the offense. For example, a high level of paranoia or delusional thinking may support an insanity defense. These tools can help determine whether a psychological condition may have impaired an individual's ability to understand the wrongfulness of their actions or to control the behavior, which is going to be relevant in arguments for diminished capacity. If we switch over and talk about custody disputes, personality inventories can assess the mental health and personality traits of parents, providing evidence on the fitness of their ability to care for their children. And these inventories can also be used to evaluate the potential impact of a parent's personality traits on their child's welfare, assessing for the risk of neglect or abuse. As we mentioned earlier, personality inventories include validity scales designed to detect malingering, which is either faking or exaggerating symptoms, or other forms of response distortion. This is crucial in forensic settings where individuals may have a motive to present themselves in a particular way to influence legal outcomes. The results of personality inventories can inform sentencing decisions by providing insights into an offender's character and their potential for rehabilitation. For example, an individual with a high level of antisocial traits may be seen as higher risk and could receive a stricter sentence or a more intensive rehabilitation program. Understanding an individual's personality profile can help in designing effective rehabilitation programs that address specific psychological needs and traits. So that was a very high-level overview, but now you have a better idea of how these personality inventories can be applied in many different ways and lots of different forensic questions that may come your way in the future. So let's circle back to some of the questions that we asked ourselves and some of the guidelines. We want to ask ourselves, do we need this test? Is this test commercially available? Is it empirically validated? Is it going to be relevant for us? Is it going to be reliable? Is there a standardized way to administer this test? Are there appropriate norms, and do those norms apply to the person that we are working with? And can we assess for response style? I want you to keep these questions in mind as you start to put together your forensic batteries here in the future. This slide has a lot of information on it. This is about the WAIS, which is the Wechsler Adult Intelligence Scale, the WAIS. And it is one of our most widely used psychological tests for assessing intelligence in adults. So I'm going to give you some background, and then we are going to break down each of the various different subtests and the index scores and how you're going to be using this. So the WAIS was originally developed by psychologist David Wechsler. It measures various aspects of cognitive ability and provides a detailed profile of an individual's intellectual functioning. So the structure of the WAIS, it consists of a series of subtests designed to measure different domains of intelligence. The latest version of the WAIS that we have right now is the WAIS 4, and it has 10 core subtests and 5 supplemental ones. These subtests assess various cognitive abilities such as verbal comprehension, perceptual reasoning, working memory, and processing speeds. So the WAIS has 4 primary indices scores. First is the Verbal Comprehension Index. You'll often see that abbreviated as VCI, and it measures verbal reasoning, vocabulary, and the ability to understand and use language. Our next index is the Perceptual Reasoning Index, the PRI, and that assesses nonverbal and spatial reasoning, as well as the ability to solve visual problems. The Working Memory Index, the WMI, evaluates short-term memory, attention, and the ability to hold and manipulate information. The Processing Speed Index, the PSI, measures the speed at which an individual can process simple or routine information quickly and accurately. So we are going to get the full scale IQ, the FSIQ, and this is derived from a combination of all the subtests that reflect an individual's overall intellectual ability, and this is the most important and commonly used score to represent general intelligence. We also have the General Intellectual Ability, the GAI. This is based on only 6 subtests of the VCI and the PRI, and this is a measure of cognitive abilities that are less vulnerable to impairment. So this may be a better option for you versus the FSIQ, just based on the person that you're working with, how engaged they are in the testing, your time constraints, your ability to administer. So these are going to be things that you have to weigh as you're working with someone in the forensic setting. So I want to give you an example of some of the subtests that are within each of these indices. Let's talk about similarities. This comes from the VCI, and a person is given 18 pairs of words, and they are asked to identify the qualitative relationship between the 2 words. Vocabulary is a subtest that requires the individual to define words of increasingly more difficulty. Block design belongs to the PRI, and this subtest requires individuals to review a model and a picture, or a picture only, and to use blocks to recreate the design. Symbol search, this subtest requires the examinee to search through a group of symbols and indicate if the symbol is in a target group if it matches it. Digit span, this one consists of 3 different components. The individual must do digit span forward, where they have to repeat digits of increasing length forward. Digit span backwards has the individual try to repeat digits of increasing length backwards. And then digit span sequencing has the individual repeat digits of increasing length in ascending order. Visual puzzles is a subtest that requires an individual to view a completed puzzle and then select 3 response options that can be combined to reconstruct the puzzle. You will notice on this slide there are some supplemental tests. which you can use if it feels relevant to what it is assessing and what it is that you are trying to measure in the individual that you're working with. So for example, under the PRI, you can see that picture completion is supplemental, as well as figure weights, and there are supplementals for each of the various indices. So now we want to know, what can the WAIS do to help you besides just giving you a score for intellectual intelligence? And the WAIS is a very valuable tool in forensic psychology to assess lots of different ways that cognitive abilities can be applied to legal contexts. So let's talk about that. Let's talk about competency to stand trial first. The WAIS is often used to assess a defendant's cognitive abilities to determine whether they are competent to stand trial. Competency requires that the individual understands the charges against them, can comprehend the court proceedings, and is able to assist their attorney in their defense. Some key areas here: the WAIS can evaluate specific cognitive functioning relevant to competency, such as verbal comprehension, so looking at their ability to understand legal language, working memory, how can they follow the court procedures, and processing speed, responding to questions in the court. We can also apply this to criminal responsibility or the insanity defense. The WAIS can help assess cognitive functioning at the time of the offense, which is crucial when evaluating criminal responsibility, particularly in cases involving the insanity defense. A very low IQ score, for example, might indicate an intellectual disability, which could be relevant in determining whether an individual has the capacity to understand their actions or to confirm their behavior to the law at the time of the offense. The WAIS can be used to assess intellectual functioning in cases where intellectual disability may be a mitigating factor during sentencing. For example, a defendant with significantly below average intelligence may receive a reduced sentence or may be ineligible for the death penalty due to intellectual disability. We are going to talk about this much more later in this presentation. Understanding the cognitive profile of an individual can inform sentencing decisions, particularly in understanding how cognitive deficits may have influenced the person's behavior. The WAIS can contribute to risk assessments by evaluating cognitive factors that may relate to the likelihood of reoffending or engaging in violent behavior. For instance, impaired cognitive functioning could be a factor of poor impulse control or problem-solving abilities. The results of the WAIS can also help to tailor rehabilitation programs by identifying cognitive strengths and weaknesses, ensuring that interventions are appropriate for the individual's cognitive level. If we think about civil cases, such as personal injury or disability claims, the WAIS can be used to assess cognitive impairments resulting from trauma, illness, or injury. This can be relevant in determining the extent of cognitive damage and the associated compensation. The WAIS can be used to assess an individual's cognitive capacity in cases of guardianship, the power of attorney, or other legal matters where mental capacity is going to be questioned. In cases involving disputes over employment or occupational competence, the WAIS can assess cognitive abilities related to job performance, such as problem solving, decision making, and learning new tasks. The WAIS can be used to evaluate cognitive fitness for duty in occupations requiring high cognitive demand, such as law enforcement or other high-stress positions. And then lastly, the WAIS is often used in forensic research to study cognitive functioning in various offender populations, contributing to a better understanding of the relationship between cognitive abilities and criminal behavior. So some other things that we may be able to obtain from the WAIS could be response styles. We want to know if this person we're working with has a concrete or an abstract way of thinking. Are they being over or under inclusive? We want to know, how does our client see the world, relationships, and their ability to express things and express themselves. This is also going to be useful in understanding their impulsivity. When we're sitting there, we're working with them, we're asking them to answer questions. Are they thoughtful in their response style, or are they very impulsive? Attention and concentration will also be assessed, and this may provide evidence of a brain trauma or a TBI, a traumatic brain injury. We're also going to have a good insight into the person's level and quality of education. The WAIS is also going to help us to determine if the individual is preoccupied with something or if they have the cognitive flexibility to be able to shift and change and focus on what is going to be essential at a specific moment in time. We can see how motivated they are by their willingness to engage in test questions, especially as the questions continue to get more difficult as you progress through the test. And all of these things are going to be relevant to psychiatric diagnosis and answering questions related to the legal question at hand. So let's talk a little bit about the WAIS in court. Does it meet the standard of care? Yes, it definitely does. The WAIS is very often used as a gold standard measured in the court system. When would you use it? You would use this very, very often, whether that's a neurocognitive injury claim, competency referrals, death penalty, which we're going to talk about that more, mitigation, and many, many others. So how are you going to report it? Well, the WAIS gives you scores, but it also gives you confidence intervals. And if the court is willing to accept confidence intervals, you definitely want to include that. If they don't allow for that, do your best and just give the scores that the WAIS reports. And then we also want to talk about the Flynn effect. So what is the Flynn effect? The Flynn effect refers to observed phenomenon of a consistent and substantial increase in intelligence scores over time and across multiple generations. This effect was named after James R. Flynn, a researcher who extensively documented and analyzed these increases. So let's talk about a couple of key points within the Flynn effect, one of which is IQ score increases. On average, IQ scores have increased about 3 points per decade since the early 20th century. This means that a person taking an intelligence test today would likely score higher than someone who took the same test several decades ago, even if their underlying cognitive abilities are similar. The Flynn effect has been observed in many countries around the world, although the rate of increase does vary between regions. Some possible explanations for the Flynn effect could be enhanced access to education, better educational methods, and more emphasis on problem solving and abstract thinking may contribute to the rise in IQ scores. Improved nutrition over the past century is believed to have a positive impact on brain development, leading to higher cognitive functioning. The increasing complexity of the modern world, including exposure to technology, media, and more cognitively demanding jobs, may stimulate cognitive development. Also, some theories suggest that smaller family sizes allow parents to invest more resources and time into each child's development, which could contribute to a higher cognitive ability. So let's talk about a couple implications for this. Because of the Flynn effect, intelligence tests need to be regularly updated and renormed to maintain their validity and accuracy. Without renorming, older tests might overestimate an individual's IQ relative to the current population. The Flynn effect suggests that comparing historical IQ scores to current ones without adjusting for this phenomenon may lead to incorrect conclusions about changes in intelligence over time. So the rule of thumb is to only make downward adjustments when the norms for your test are about 10 years out of date. In general, clinical practice, downward adjustments are not common. Test publishers do discuss the Flynn effect, but they don't recommend score adjustments. I personally have never done a downward adjustment, but it's an important concept for you to be aware of, especially whenever it comes to life and death decisions, such as Atkins v. Virginia. That was a landmark case in 2002. I imagine that you guys have already covered this in your coursework, but I'm going to do a brief overview just so we are on the same page. So Atkins v. Virginia, again, this case happened in 2002. This is a landmark case in which the U.S. Supreme Court ruled that it is unconstitutional to impose the death penalty on individuals with intellectual disabilities. The decision was based on the Eighth Amendment, and that is the prohibition of cruel and unusual punishments. So let's talk a little bit about the background. Daryl Atkins was convicted of abduction, armed robbery, and capital murder. During the sentencing phase, the defense presented evidence that Atkins had an IQ of 59, suggesting that he had an intellectual disability, formerly referred to as mental retardation. You'll probably see that in your case law as you're reading it. Nowadays, we call it intellectual disability. So despite the evidence of his intellectual disability, Atkins was sentenced to death by a jury in Virginia. Then it went to the Supreme Court, and a 6-3 decision held that executing individuals with intellectual disability violates the Eighth Amendment's ban on cruel and unusual punishment. The court argued that individuals with intellectual disability have diminished capacity to understand and process information, communicate, and engage in logical reasoning, control their impulses, and understand the consequences of their actions. So this reduced capacity means that they're less morally culpable and more susceptible to wrongful execution. So the impact of this, the legal ruling established that states cannot execute individuals with intellectual disabilities, although states retain the discretion to define intellectual disability and determine how it is assessed. With regard to future cases and legislation that clarified the standards and procedures for determining intellectual disability in capital cases. In summary, Atkins v. Virginia is a crucial case in our U.S. legal system. It prohibited the execution of individuals with intellectual disability, reinforcing the principle that punishments must be appropriate to the culpability of the offender. So a psychologist and mental health professional, we need to follow our ethics codes. This is a guiding light for us. It is very, very important. And as such, we need to report the observed scores. We do not advocate for or against the adjustment for the Flynn effect. What we can do, however, is we can inform the court about it. We can provide education like we just talked about here. We can provide the adjustment scores where available and appropriate. And what we can do is we can report the scores if they are based on data of the norms for the particular test, and we can provide adjusted scores for the court. We don't want to simply ignore this, but we can leave it up to the court on how they choose to proceed and which scores they choose to put the most weight on. So circling back, we had mentioned the MMPI earlier. We're going to do a little bit more of a deep dive here. The MMPI, we're going to talk about the MMPI 3 here today. This is the most widely used and researched standardized psychometric test of adult personality and psychopathology. So the 3 is our most recent test. It came out in 2020, and it is a psychological assessment tool widely used in forensic settings to evaluate personality traits, psychopathology, and behavioral tendencies. It is designed to provide a more contemporary and culturally relevant assessment. That's why we're going to focus on the 3 here in our discussion today. But just know that the MMPI has been around for a very long time, and I would be remiss if I didn't mention that the MMPI stands for Minnesota Multiphasic Personality Inventory. So we're going to talk broadly, and then we're going to drill down further into the various scales. So some key features of the MMPI 3. It consists of 335 true-false items. It includes 52 scales, which are grouped together in several categories. So first, the validity scales. They assess the test-taking attitude of the respondent, such as honesty, consistency, and whether they are exaggerating or minimizing symptoms. We've got higher order scales. These measure the broad psychological dimensions, such as emotional, internalizing dysfunction, thought dysfunction, and behavioral/externalizing dysfunction. We've got the restructured scales. These assess core components of major psychological disorders, such as depression, anxiety, and antisocial behavior. We do have specific problem scales. These provide detailed information on specific issues like substance abuse, anger, suicidal ideation, and aggression. We also have the personality psychopathology 5 scales, which are known as the Psy 5. These assess personality dimensions related to psychopathology, including aggressiveness and disconstraint. So let's talk about some purposes and applications in forensic settings. The MMPI-3 helps forensic psychologists identify and evaluate mental health conditions such as mood disorders, personality disorders, and thought disorders, which are all going to be extremely relevant to the legal context. It provides insights into personality traits that can influence behavior, such as impulsivity, aggression, or tendencies towards deception, which are again crucial in assessing criminal behavior, risk for reoffending, or potential for rehabilitation. The MMPI-3 can be used to assess an individual's mental state in relation to legal criteria, such as competency to stand trial or criminal responsibility at the time of the offense. It can provide evidence of mental illness or personality dysfunction that could impact legal decisions. As we discussed earlier, as far as risk assessment goes, the MMPI definitely can help us here to evaluate the risk for future dangerous behavior, such as violence or sexual offending, based on personality traits and psychopathological symptoms. In family law or civil cases, the MMPI-3 can assess the mental health and personality characteristics of individuals involved in custody disputes, personal injury claims, or parental fitness. So we need to talk about the interpretation of the results, especially when it comes to validity. In forensic assessments, the validity scales are going to be of the utmost importance because they help determine whether the individual is providing relevant, reliable, and honest responses. For example, exaggerated response pattern may indicate malingering. Again, that means faking or exaggerated symptoms. We, as the psychologists, will use the clinical scales to develop a psychological profile that can be used to support legal arguments or decisions. For example, a high score on the antisocial behavior scale might suggest a predisposition to criminal behavior, which could be relevant in sentencing or parole decisions. The MMPI-3 results are typically integrated with other sources of information, like we talked about earlier, the assessment, which is putting lots of different pieces of the puzzle together, such as interviews, collateral reports, legal documents, to provide a comprehensive assessment. So the MMPI-3 is just going to be one of those tools. So some advantages that we have when using the MMPI-3 in forensic context will be that it is extensively backed by research and normative data, making it a scientifically reliable tool for forensic assessments. It is versatile and can be used in a wide range of forensic assessments, such as criminal cases to civil disputes, and by various professionals, including psychologists, lawyers, and judges. The MMPI-3 is our most updated. As I mentioned, it came out in 2020, and it includes norms and content that reflect contemporary society, diverse populations, and it is more applicable to current forensic assessments. So with the MMPI-3, like I mentioned, we've got several clinical scales. We are going to do a little bit more of a deeper dive into these. So the clinical scales are going to assess various aspects of an individual's psychological functioning, and these scales are going to help us identify and diagnose mental health disorders, further understand personality traits, and evaluate behavioral tendencies. The MMPI-3, it does retain many of the core clinical scales from the previous versions of the MMPI-2 and the beloved MMPI-2-RF, but it's been updated and refined to improve its accuracy and relevance in modern context. So first we're going to talk about demoralization. This measures a sense of dissatisfaction, helplessness, and overall negative emotional experience. High scores suggest hopelessness and are often associated with depression and general psychological distress. Our next scale is somatic complaints. This assesses the extent to which an individual experiences and is preoccupied with physical symptoms that may have no medical basis. High scores may indicate somatic symptom disorder or other health anxiety related issues. Our next scale is low positive emotions. This measures an individual's level of positive affect and engagement with life. High scores suggest reduced experience of positive emotions, often seen in individuals who have depression or anhedonia. Next scale, cynicism. This assesses a tendency towards distrustful or cynical attitudes towards others. High scores may reflect a general mistrust and negative outlook on relationships, which can be associated with paranoid personality traits. Next scale, antisocial behavior. This evaluates tendencies towards rule breaking, rebelliousness, and disregard for societal norms. High scores on this scale are often seen in individuals with antisocial personality disorder or conduct disorder and may indicate a higher risk of criminal behavior. Next scale, ideas of persecution, measures paranoid thinking, including beliefs that others are out to harm or conspire against the individual. High scores are associated with paranoid personality disorder or other delusional disorders. Our next scale is the dysfunctional negative emotions, which assesses anxiety, anger, irritability, and emotional instability. High scores on this indicate emotion dysregulation, which is commonly seen in mood and anxiety disorders, as well as borderline personality disorder. Our next scale is aberrant experiences. This evaluates unusual perceptions and thoughts, such as hallucinations or delusions. High scores may suggest psychotic disorders or other conditions involving distorted reality, such as schizophrenia. And next, we've got the hypomanic activation. This scale assesses mood elevation, increases in energy, and impulsivity often associated with hypomanic episodes. High scores are linked to bipolar disorder, particularly during hypomanic or manic episodes. Now we're going to talk about the specific problem scales. And in addition to the restructured clinical scales, the MMPI-3 included specific problem scales that provide more detailed assessments of particular issues. The first is internalizing scales. This assesses specific problems related to internal distress, such as depression, anxiety, and suicidal ideation. The externalizing scales evaluate outward behavior, including aggression, substance use, and rule breaking. The interpersonal scales measure specific difficulties in relationships, such as family problems and social avoidance. And lastly, the interest scales assess areas of interest that might reflect personality traits, such as aesthetic literary interests or mechanical physical interests. Now we're going to talk about the validity scales of the MMPI-3, and they are designed to assess truthfulness, consistency, and overall reliability of responses provided by individuals taking a test. These scales help identify various forms of response bias, including exaggeration, minimization, and inconsistent responding, which are all going to be of the utmost importance in forensic assessment. So first, we're going to talk about VRIN, Variable Response Inconsistency Revised. This measures the consistency of response to paired items that are similar or opposite in content. High scores suggest that individuals may not be responding consistently, possibly due to confusion, inattention, or just random responding, and this could indicate that the results may not be valid. Next is TRIN, the True Response Inconsistency Revised. This assesses the consistency in responding to pairs of items that are worded in opposite directions, but should elicit opposite responses. So you're going to respond true to one and then false to the other as an example. High or low scores may indicate a tendency to respond in a uniformly true or a uniformly false manner, regardless of the content of the items, and this can suggest a pattern of carelessness or pattern responding. Next scale is infrequent responses revised. This detects unusual or atypical responses to items that are rarely endorsed by general population or specific normative groups. High scores on this scale indicate that the individual is exaggerating symptoms, experiencing extreme distress, or endorsing unusual or bizarre thoughts. In a forensic context, it could suggest malingering or feigned psychopathology. Our next scale is infrequent psychopathology responses revised, and this is the FPR. It identifies over-reporting of psychopathology by detecting responses that are rarely endorsed, even by individuals with severe mental health conditions. High score suggests possible exaggeration or fabrication of psychological symptoms, particularly those that are not typically associated with genuine psychopathology. Next scale is infrequent somatic responses. This is the FS. It assesses the tendency to overreport somatic or physical symptoms that are rarely reported by medical patients or even in the general population. High scores may indicate exaggeration or malingering of physical symptoms, which can be relevant in cases of personal injury claims or disability evaluations. Next scale is Symptom Validity Scale Revised. This is the FBSR. Originally developed to detect exaggeration of cognitive and somatic symptoms in personal injury cases, this scale assesses the likelihood that an individual is over-reporting symptoms. High scores may suggest the individual is attempting to present themselves as more impaired than they actually are, often in contexts where secondary gain, such as financial compensation, is possible. Next scale, Uncommon Virtues Revised. This scale is the LR. The purpose of this scale is to measure the tendency to present oneself in an overly favorable or virtuous manner by denying common human flaws and faults. High scores may indicate the individual is underreporting negative traits or behaviors and trying to appear more favorable, which can be important in forensic evaluations where individuals may be motivated to present themselves in a positive light, such as, for example, a custody case. Next, we have Adjustment Validity Revised. This is KR. This assesses defensiveness by evaluating the tendency to minimize psychological problems and present oneself as well-adjusted. High scores may indicate the individual is attempting to deny or downplay psychological difficulties, which could suggest a lack of insight or effort to conceal mental health issues. Lastly, here we've got the Response Bias Scale. That is the RBS. And this specifically is designed to detect exaggeration or feigned cognitive deficits, particularly in forensic or neuropsychological context. High scores may suggest malingering or exaggeration of cognitive impairment, which is specifically relevant to legal cases involving claims of a brain injury or cognitive dysfunction. So I know that that was a lot of information. As far as the validity scales go for the MMPI-3, they're going to be absolutely essential for ensuring that the test results are accurate and they accurately reflect the individual's true psychological state. These validity scales help forensic psychologists detect and interpret various response styles such as exaggeration, minimization, inconsistent responding in forensic settings. These scales are particularly important for assessing the credibility of an individual's self-report symptoms and ensuring that the test data can be used reliably in the legal context. So let's talk about the MMPI in court. Does it meet the standard of care? Yes, but there is a fair amount of debate as to its proper use and interpretation. The MMPI generally does meet the standard of care in forensic psychology, but it must be used contextually appropriately and supplemented by other assessments and evaluations to ensure a comprehensive and reliable result. So the MMPI-3 is built on robust empirical foundation of its predecessors of the MMPI, the MMPI-2, and the MMPI-2RF, and includes updated norms and revised scales to reflect current psychological and cultural context, as we mentioned. This extensive research supports its reliability and validity in assessing a wide range of psychological conditions, personality traits, and response patterns. The MMPI and its various different versions, including the 3, are among the most widely used and researched psychological assessment tools in forensic settings. It is regarded by forensic psychology community for its ability to detect response biases such as malingering, assess mental health disorders, and provide insights into personality traits relevant to legal cases. The MMPI-3 is suitable for various forensic applications, like you already heard me mention, competency evaluations, criminal responsibility, risk assessment, custody evaluations, and many more. Its validity scales are particularly important in forensic contexts where individuals may have motivations to present themselves in a specific light, such as exaggerating or minimizing. The standard of care in forensic psychology involves using multiple sources of data to form an opinion, like we've been talking about all throughout this lecture. So the MMPI-3 should be used in conjunction with other psychological tests interviews, collateral information, and case history to provide a well-rounded opinion. A forensic psychologist must interpret the results of the MMPI-3 within the context of the specific legal question and consider the possibility of malingering, response biases, and other factors that may affect the validity of the test. The use of the MMPI-3 in forensic settings can be subject to legal scrutiny, especially in court cases where the results may significantly impact legal outcomes. Forensic psychologists must be prepared to justify the use of the MMPI-3, explain its relevance to the case, and defend its findings under cross-examination. It's important for psychologists to demonstrate that the MMPI-3 was administered and interpreted in accordance with established standards, and that it is an appropriate tool for the specific forensic question at hand. When we think about ethics, the American Psychological Association, the APA, and other relevant professional organizations provide ethical guidelines for the use of psychological assessments in forensic settings. These guidelines emphasize the importance of using validated, reliable tools such as the MMPI-3 in a manner that respects the rights and dignity of the individual being assessed. Ethical practice also requires transparency about the limitations of the MMPI-3, such as the fact that it is one tool among many that should be used to inform a forensic evaluation. So when would we use the MMPI in court? If we need to determine the validity of symptoms, if we need help with a difficult differential diagnosis, or if we need help in supporting inferences about one's behavior. How do we report it? So we want to describe the test development, the scoring, and the validity of the assessment. All of this information is going to be found in the manual. And once you start doing these reports regularly, you're going to have a standard write-up for each test that you use as a template. But nonetheless, you need to discuss the confidence in the code types. So avoiding interpreting code types that have low reliability. So we didn't discuss this yet, but we're going to go ahead and discuss it here now. The scoring and code types for the MMPI-3, they're going to be essential for interpreting the results and understanding the psychological profile of the person who's being assessed. So we need to talk about the raw scores to T-scores first. Initially, raw scores are obtained by counting the number of items answered in a certain way. For example, all the items that are true versus all the items that are endorsed as false for each scale. Then raw scores are converted to T-scores, which are standardized scores with a mean of 50 and a standard deviation of 10. T-scores facilitate comparison to normative data and help interpret the results relative to a reference population. With regard to the clinical scales, the MMPI-3 includes several clinical scales that measure various aspects of personality and psychological functioning. We discussed these earlier in our slides, and each scale is given a T-score, which indicates how the individual score compares to the normative sample. Similarly, the validity scales, we discussed these at length. Scores on these scales help determine if a test results are credible and whether any response biases may affect interpretation. So let's jump into code types. Basic code types represent the combination of the highest score on 2 or more clinical scales. These codes are used to understand the overall pattern of psychological functioning. An example code type might be 4-8, which is going to indicate significant scores on both the antisocial behavior and aberrant experiences scale, suggesting a profile characterized by both impulsive and unusual thought patterns. But we've also got subtype codes, and these are more specific patterns that involve combinations of different clinical scales, providing a nuanced understanding of particular psychological profiles. The interpretation of code types involves looking at the highest scoring scales and their combinations to determine dominant personality traits and psychological issues. Code types help to identify common patterns associated with specific psychological conditions. For example, a high score on the antisocial behavior combined with a high score on the ideas of persecution scale might be indicative of a profile with significant antisocial traits and paranoid thinking. Some example code types could be a 1-2-3 code type with a pattern of a high score on number 1, somatic complaints, on the second, low positive emotions, and number 3, cynicism, and these scales may indicate a profile characterized by significant somatic distress, a lack of positive emotional experiences, and a cynical outlook. Another example is the 6-8 code type. High scores on 6, ideas of persecution, and 8, aberrant experiences, could suggest a profile with paranoid and psychotic features. A few additional considerations that we want to think about. While the code types provide valuable insights, they must be interpreted in the context of the individual's history, their current circumstances, and other assessment data. Clinical judgment is going to be essential in understanding the full implications of the MMPI-3 results. With regard to the supplementary scales, the MMPI-3 also has those specific problem scales as well, and they can help to provide additional information about specific areas of functioning and of substance use or interpersonal difficulties. So again, remember that as far as the code types go and using the MMPI-3 in court, we really want to avoid interpreting code types of low reliability. Okay, I know that that was a lot of information. Thank you for hanging in there with me. I hope that you feel like you learned a lot from our lecture here of psychological tests and forensic exams. I look forward to our time together and the many lectures that we have scheduled here for the future. So thank you for your time.